Defensive Tactics Study Guide, Part 2. Explain how the injury potential to an officer may affect their response. An officer's selection of force options is guided by their personal risk of injury. If an officer is physically exhausted, injured, outnumbered, facing an opponent with superior size or skill, or isolated without backup, their injury potential rises, which can legally justify a higher level of force, response, or immediate tactical disengagement. Define passive resistance: a subject's verbal or physical refusal to comply with an officer's lawful direction, where the subject does not make physically evasive or attacking movements to fight the officer. For example, an individual sitting down and refusing to stand up. Define active resistance: a subject's use of physically evasive movements directed toward the officer to prevent control, such as bracing, tensing muscles, pushing, or pulling away from the officer's grip. Define aggressive resistance: a subject's hostile attacking movements that comprise an intention to cause injury, but are not likely to cause death or great bodily harm to the officer or others. Example, throwing a punch, grabbing the officer's throat, kicking. Define deadly force resistance: a subject's hostile attacking movements with or without a weapon that create a reasonable perception by the officer that the subject intends to cause and has the immediate capability of causing death or great bodily harm. Demonstrate officer presence. Project a high degree of command presence. This is demonstrated by maintaining an erect posture, high alertness, clean and proper uniform appearance, and solid grooming, which collectively communicates an immediate readiness to take control of the situation. Define physical control: achieving subject compliance or mechanical custody through empty hand techniques or leverage enhanced tools, including methods like pain compliance, transporter restraint devices, takedowns, and striking. Define less lethal: a weapon or tool that is not fundamentally engineered, intended, or reasonably expected to cause death or great bodily harm when used according to standard operating parameters, such as batons, ECDs, or chemical agents. Discuss deadly force in relation to defensive tactics. Deadly force within defensive tactics is any response likely to cause death or great bodily harm, including specialized empty hand maneuvers like throat strikes or eye gouges. Under State Statute 776.07 of the Florida statutes, correctional and law enforcement officers are legally justified in using deadly force if they reasonably believe it is necessary to prevent the escape of a lawfully detained felon from a penal institution. Identify what is needed to justify using deadly force. The officer must possess a clear, articulate, and objectively reasonable belief that they or another person are facing an imminent threat of death or great bodily harm from the subject. Identify the circumstances when an officer has the duty to intervene. An off-duty officer has an absolute legal duty to step in and stop another officer from applying excessive force that exceeds what is legally permissible, objective, or dictated by agency policy. This intervention must be reasonably based on the totality of circumstances and must not jeopardize the observing officer's health or safety. Identify the subject's ability, opportunity, and intent as they relate to the officer's response to resistance. Ability: the subject has the physical means or tools to cause harm, weapons, size, martial arts skill. Opportunity: the subject is close enough or unhindered enough to execute their threat within physical striking distance or weapon range. Intent: the subject displays an internal willingness to commit a harmful or criminal act, shown via threatening language, aggressive postures, or explicit behaviors. Explain what totality of circumstances means. The legal standard requiring an evaluation of all environmental, personal, and situational facts known or reasonably perceived by the officer at the exact millisecond they made the decision to use force. Identify various situational factors that may influence the use of force. Key factors include severity of the suspected crime, immediate threat level posed by the subject, subject's known history of violence or mental illness, presence of innocent bystanders, access to weapons, size, weight, age, and fitness disparities, duration of the physical struggle, and environmental hazards. Apply reasonable and necessary force to given situations. Officers must evaluate the subject's resistance level dynamically and apply the minimum necessary force option required to safely establish, control, and neutralize the threat, ensuring every action can be thoroughly articulated in a use of force report. Explain how survival stress affects confrontation between a subject and an officer. Survival stress automatically triggers a massive autonomic nervous system response, fight or flight, injecting adrenaline into the bloodstream. This fundamentally alters the officer's physical capabilities, warps sensory perception, and slows analytical decision-making during a critical incident. Describe the 4 instinctual reactions when experiencing survival stress. The 4 basic pre-programmed instinctual human responses to an extreme threat are fight, flight, posture, making a display of force, or submit, giving up control entirely. Describe the physiological changes that may occur while experiencing survival stress. Psychological and perceptual shifts include tunnel vision, loss of peripheral sight, loss of depth perception, auditory exclusion or diminished hearing or amplified hearing, time distortion, moments feeling accelerated or slowed, and a severe reduction in analytical reasoning as the brain switches to pre-trained short mental shortcut. Describe the impact survival stress may have on an officer's decision making. High stress heavily limits complex cognitive processes because detailed critical thinking is impaired. Officers default to basic repetitive physical patterns and mental shortcuts based on their muscle memory and repetitive training exposure. A lack of decision-making time increases the likelihood of a tactical mistake. Describe the changes that may occur in speech patterns while experiencing survival stress. Extreme stress causes the vocal cords to involuntarily constrict. This results in a noticeably higher vocal pitch, voice cracking, or garbled speech. Officers may experience quote unquote exhilaration speech or rapid talking, uncontrollable cursing during or immediately after the adrenaline dump subsides.